For many retirees, one of the most important healthcare decisions involves choosing between Original Medicare and Medicare Advantage. At first glance, the options can appear confusing. Both provide access to Medicare benefits, yet they operate in different ways and may offer different experiences for beneficiaries. Medicare Advantage, also known as Medicare Part C, is an alternative way to receive Medicare benefits through private insurance companies approved by Medicare. Instead of receiving coverage directly through Original Medicare, beneficiaries enroll in a Medicare Advantage plan that combines Medicare benefits into a single package. Over the past 2 decades, Medicare Advantage has grown significantly in popularity. Today, millions of Americans choose Medicare Advantage plans as part of their retirement healthcare strategy. One reason for this growth is convenience. Many Medicare Advantage plans combine hospital coverage, medical coverage, and prescription drug coverage into a single plan. Some plans may also include additional benefits such as dental services, vision care, hearing coverage, wellness programs, or fitness-related benefits. However, popularity alone does not mean a particular option is right for every retiree. Healthcare needs vary significantly from person to person. A plan that works well for one beneficiary may not be the best choice for another. Understanding the basics of Medicare Advantage is therefore an important first step before comparing benefits, costs, provider networks, and coverage options. It is also important to recognize that Medicare Advantage plans are offered by private companies and can differ by location. Available plans, provider networks, premiums, and benefits may vary depending on where a beneficiary lives. As a result, retirees often encounter a wide range of choices during enrollment periods. The objective is not to determine whether Medicare Advantage is universally good or bad. Rather, the goal is to understand how these plans work and how they compare with Original Medicare. In this briefing, we will examine potential advantages, possible limitations, and practical considerations that retirees should evaluate when deciding whether Medicare Advantage may fit their individual healthcare needs. Because informed decisions often begin with understanding the available options, one reason Medicare Advantage plans have become increasingly popular is the range of benefits they may provide beyond Original Medicare. Many beneficiaries appreciate the convenience of having multiple forms of coverage combined within a single plan. For example, many Medicare Advantage plans include prescription drug coverage. Rather than managing separate medical and prescription plans, beneficiaries may have access to both through one provider. Some plans may also offer benefits that are not typically included in Original Medicare. These benefits can include routine dental care, vision services, hearing coverage, fitness programs, transportation assistance, or wellness-related services. For retirees who regularly use these services, the additional benefits may provide meaningful value. Another potential advantage is predictability. Many Medicare Advantage plans establish annual limits on out-of-pocket expenses for covered services. This feature can help beneficiaries understand the maximum amount they may be required to spend during a given year for covered medical care. Some retirees find this feature reassuring when planning healthcare budgets. Medicare Advantage plans may also emphasize coordinated care. Many plans encourage communication among healthcare providers and may offer care management programs designed to support individuals with chronic health conditions. For some beneficiaries, this approach can simplify the healthcare experience. Cost is another factor frequently discussed when comparing Medicare options. Depending on location and plan selection, some Medicare Advantage plans may offer competitive premiums or additional benefits that appeal to retirees seeking comprehensive coverage. However, benefits and costs can vary significantly between plans. This is why careful comparison remains important. The value of any healthcare plan depends not only on the benefits offered, but also on how well those benefits align with an individual's healthcare needs, preferred providers, medications, and lifestyle. Understanding these potential advantages provides an important foundation for evaluating whether Medicare Advantage may be a suitable option. While Medicare Advantage plans may offer attractive benefits, it is equally important to understand some of the potential limitations that retirees should consider before enrolling. One of the most commonly discussed factors involves provider networks. Many Medicare Advantage plans operate through networks of doctors, specialists, hospitals, and healthcare providers. In some cases, beneficiaries may pay higher costs or receive limited coverage when seeking care outside the plan's network. For retirees who travel frequently or spend significant time in multiple states throughout the year, provider networks may deserve careful evaluation. Another consideration involves prior authorization requirements. Some plans require approval before certain procedures, treatments, medications, or services are covered. While these requirements are intended to manage healthcare costs and coordinate care, they can sometimes add administrative steps for patients and providers. Coverage rules may also change from year to year. Benefits, provider networks, premiums, prescription drug formularies, and cost-sharing arrangements can evolve over time. As a result, retirees are often encouraged to review their plan annually rather than assuming coverage will remain unchanged. Specialist access is another factor some beneficiaries consider. Depending on the plan, referrals may be required before seeing certain specialists. This process may differ from the experience some beneficiaries have under Original Medicare. It is important to remember that not every potential drawback affects every individual equally. For some retirees, provider networks and prior authorization requirements may be minor considerations. For others, they may be significant factors in the decision-making process. The objective is not to view Medicare Advantage as inherently better or worse than Original Medicare. Rather, it is to understand that every healthcare option involves trade-offs. By recognizing both the advantages and the limitations, retirees can make more informed comparisons and select coverage that best aligns with their healthcare needs and personal preferences. As we conclude this briefing, it is important to remember that choosing between Original Medicare and Medicare Advantage is a personal decision. There is no single option that is best for everyone. The right choice often depends on an individual's healthcare needs, budget, preferred doctors, medications, travel habits, and overall retirement goals. One useful starting point is to consider how healthcare services are currently being used. Some retirees visit specialists frequently or require ongoing treatment for chronic conditions. Others may use healthcare services only occasionally and place greater value on additional benefits such as dental, vision, or hearing coverage. Provider preferences can also play an important role. Before enrolling in any plan, retirees may wish to verify whether their preferred doctors, hospitals, and specialists participate in the plan's network. Prescription medications deserve similar attention. Reviewing drug formularies and pharmacy networks can help beneficiaries better understand potential costs and coverage. It is also important to recognize that healthcare needs can change over time. A plan that works well today may not be the ideal solution several years from now. This is one reason many experts encourage retirees to review their Medicare coverage during annual enrollment periods and remain informed about plan updates. The objective is not to select the most popular plan. The objective is to select the plan that best aligns with individual circumstances. Healthcare decisions are often most effective when they are based on personal needs rather than advertising, assumptions, or the experiences of others. Medicare Advantage continues to play an important role in the retirement healthcare landscape, and for many beneficiaries, it may provide valuable benefits and convenience. At the Retirement Briefing, our mission is to help you better understand the economic and healthcare issues shaping retirement in America so that you can make more informed decisions with confidence. Thank you for joining us for this edition of the Retirement Briefing.